NTV, turning on your world.
Today on Your World.
Mara ya kwanza nilipodungwa, nikitoka hapa ilikuwa inauma bado, lakini nikienda ilikuwa imeacha.
The most active ingredient in the composition of the venom is a component called melittin.
Now I'm even more scared to try because I wanted to really try. Thanks, Kilonzo. Well, hi there and welcome to another episode of Your World. My name is Winnie Lubembe. Now, listen to this. Something that is considered to cause pain and swelling is now used to actually treat pain and swelling. What exactly am I talking about? I am talking about apitherapy, or if you like, bee venom therapy. And the big question is, how is this something that causes so much pain then be used to treat conditions like arthritis or severe inflammation? Well, that is what we are here to find out right here at Bella Farm. So come with me and let's talk to Simon, who has had a severe case of migraine, and to understand how apitherapy has helped him with the pain. So come along. Well, before we get to understand more about apitherapy and what it's all about, or bee venom therapy, if you want, then let's get to meet Mr. Maina to tell us what his condition was, how he found out about apitherapy, and how he is doing so far. So, asante sana for sparing your time kuongea na sisi, James Maina.
Yes.
So, uliniambia ulikuwa unaumia na nini? Migraine. Kwa muda gani?
Kwa muda wa miaka 15.
Okay.
Nimekuwa na hiyo shida.
All right. So ulikuwa tuelezee ulikuwa like ilikuwa inauma kiasi gani? Kwa sababu unajua kila mtu anasema naumwa na kichwa, but yako ilikuwa
ilikuwa inaniuma kiasi mpaka sioni mzuri. Kwanza usiku siwezi endesha gari. Lazima niende nyumbani mapema. Lakini sasa nasikia iko sawa.
Okay. All right. So kabla ukuje hapa, ulitumia dawa gani? Ulienda hospitali? Ukaambiwa nini?
Kabla nikuje hapa nilikuwa nimeenda hospitali nyingi mpaka nikafanyiwa x-ray. Kuna kitu ilipatikana, ikakuwa sasa nitumie painkiller. Nimetumia painkiller hiyo miaka yote. Kwa bahati mzuri nikalete customer hapa, mgonjwa. Sasa na mimi nikakuwa nimepata usaidizi. Nikaongea na daktari, nikamwambia shida yangu na akanitibu. Sasa kichwa iko sawa.
Okay. All right. So ulikuwa unameza painkiller mara ngapi kwa siku? Hizo painkiller
asubuhi na jioni.
Asubuhi na jioni. So ulikuwa unauma na kichwa like kila siku ama
sio kila siku, kila saa.
Kila saa.
Kila saa.
So kwa asubuhi hadi usiku ukilala?
Hata nikilala, nikiamuka bado ni hivyo hivyo. Nikishida ni hivyo hivyo. Lakini nilikuwa na meza mara 2, asubuhi na jioni.
Na mchana ulikuwa unaweza kufanya kazi yako ama hiyo
kichwa? Nilikuwa nafanya tu kwa kujikaza. Vile uwezi kaa kwa nyumba.
Okay. So na meza painkiller asubuhi na jioni kila siku kwa sababu unaumwa na kichwa kila saa. Pain level yako ilikuwa kiasi gani? Like from a scale of 1 to 10. Unaweza sema hiyo uchungu ilikuwa
acha niseme 8.
8. Okay. All right. So ukaleta mgonjwa na mimi nikakuja nikaelezea daktari shida yangu na akanitibu. Okay. So alikutibu. So ulikuja akakwambia tutakufanyia
hivi na hivi. Na ukitoka hapa kichwa haitauma tena na ikaasha mpaka wa leo. Na ndio umeona nimerudi hapa kuleta bibi yangu na yeye akona shida ya mgongo.
Pia akadungwe. Okay. Sasa vile daktari alikwambia atakuwa anatumia nyuki. So what was your first thought? Vile tu ulisikia atakuwa anatumia nyuki inakusting?
Wakati aliniambia atatumia nyuki nilishindwa hii nyuki itafanya kazi namna gani. Na sioni kama iko na sindano iko na dawa. Lakini nikasema kama hawa nimeleta wamepona, hata mimi nitadungwa.
Okay. So ulianza kudungwa lini? Umeenda sessions ngapi?
Nimedungwa sasa, hii ni nitadungwa leo mara ya 3.
Okay. So mara ya kwanza vile ulidungwa ulisikia aje?
Mara ya kwanza nilipodungwa, nikitoka hapa ilikuwa inauma bado. Lakini nikienda ilikuwa imeacha.
Kabla ufike nyumbani umeacha kuumwa?
Ilikuwa imeacha kusema kweli. Hata nikawaambia hao kichwa yangu imeacha
kuuma. Okay. Kwa sababu mtu anaweza sema lakini si ulikuwa unameza painkiller? Hizo painkiller ulikuwa
sio kuyo, nilikuwa nimemeza.
Na bado
sasa nilikuwa nataka ningojea jioni. Lakini ya jioni sikumeza.
Kichwa iliacha kuuma. Okay. So hiyo siku ulidungwa mara ngapi?
Nilidungwa nyuki 4. Hata saa hii atanidunga 4.
Atakudunga 4. So ulidungwa 4 hiyo siku.
Ingine nikadungwa 4.
Nikadungwa 4.
Na leo nadungwa 4. Na akitaka kuniongezea 1. Ni sawa.
Haitakuwa mingi sana, lakini tutaongea na daktari pia tuambie dosage inakuwa aje. So wewe saa hii umedungwa, this will be your 3rd session. Lakini unasema hauna kichwa. Bado 3rd, si ndio? Lakini umesema sisi tulidungwa ya kwanza umangu na kichwa. But mtu anaweza uliza, so kama ulipona, kwa nini nirudi for the 2nd session?
Unajua kwa nini nirudi? Daktari aliniambia ni lazima nimalize dose.
Okay.
Na dose ni mara ngapi? Si ni 4. Sasa bado nimebakisha ingine 1.
Okay. Lakini sasa unasema unasikia
sasa ni hata nikikataa kukuja haina shida. Lakini ni lazima nimalize dose.
Okay. All right. Tutaongea na daktari atuambie anajua aje wewe unahitaji dose fulani, mwingine anahitaji dose kiasi gani, na all those things. Lakini umesema umeleta bibi yako. Akadungwe.
Hapa hata akitaka kukuambia atakwambia. Ya mgongo.
Okay. Ameshadungwa.
Amedungwa. Mmepata kama achadungwa.
Okay. All right. So ujairudi hata hospitali kuangalia kichwa?
Hata sirudi haraka sasa.
Macho unaona?
Iko sawa. Kusema kweli.
Macho iko sawa.
Iko sawa.
So unaweza ambia nini wale watu wako nyumbani wanatuangalia?
Wale wako nyumbani naweza kuambia wasikuve roho kama uko na shida. Kuja kwa huyu daktari atakuponya.
Okay.
Mtafute na ni wa ukweli. Najua watu wengine wanaweza fikiria sasa labda unaenda kwa Kalumanzila. Huyu ni wa ukweli. Ni kitu unaona anakufanyia.
Lakini unajua kuna watu wengine wako na hiyo temptation now that unajua si ni nyuki tu. Unajua kuna watu wengine wanaenda wakachukue nyuki, wakafuge nyuki, and then akisikia na uchungu kidogo anajidunga.
Lakini
wewe
hiyo hapana. Uwezi kama hujasoma kuhusu hiyo nyuki uwezi. Wewe ujui ni gani iko na dawa, ujui ni gani ya asali. Sio nyuki yoyote. Uwezi fuga alafu ujidunge.
Okay. So, well, let's speak to let's speak to Dr. Kamboyo and get to really understand. So then, how does he know what dosage to give, and after how long should people experience some sort of relief? Okay, and what are some of the other conditions that apitherapy can help with? All right, even as he finishes his session with Mr. Minor. So let's welcome Dr. Take us through the next session.
So for every patient, every condition, there's some cardinal points that you administer the beasting. But first of all, because now this is a 3rd timer, some patients respond very well, especially if you don't have any allergy and you've been on other conventional medicine. It really helps because your condition is not exaggerated compared to somebody who had neglected the condition. So for his condition, he had really tried, and when he came, I told him, for migraine is one of the conditions that we know reacts very well. The other one is the numbness, but for migraines, we really like it is almost like an instant. So we tested him for allergy, and he was okay, no allergy, just a normal wheeling. So we subjected him to stings. So the first time we did 4, the second time we did also 4. But this time we'll add 2 more to be 6. So because it's progressive, because every person is has got their own internal conditions, we do it progressively, because also the venom level also depends from the bee. Based on age, the older the bee, the higher the venom content. Yeah. So because we are not able to discern specifically,
yes, and see how old the quote-unquote old the bee is. Okay,
so
all right.
That's why it's a bit we go progressively.
All right. So what are some of the cardinal points, like you said, for migraine?
So for migraines, we do this called bladder 11. We also do bladder 10, both sides, and also we do triple 20. So once you say triple 20, it's here, bladder, this meridian, this point and this point. These are traditional Chinese acupuncture points, so which have been integrated into apitherapy for apipuncture. So those points are really working for some of those conditions.
Okay, all right. So you said today you do what?
So you do bladder 10 and triple 20.
Okay. All right. So those are like directly linked to the...
Those are directly linked to the brain.
Okay. Yeah, I see that.
For migraines, we've seen them working very well.
All right. I mean, he said what after the second session? The first session, he went home and he was okay.
It's very magical, by the way.
Yeah.
Well, you cannot see the word magical, but it's almost like instant for migraines. And if you see somebody coming once and second time without any improvement, then technically maybe there was more damage beyond the migraine.
Okay.
Yes.
All right. Well, let's see. Weren't you scared?
No, we take them through a session,
so
he's able to relax.
Okay.
But if he's not a bit nervous, we don't attempt, because we don't want issues.
Okay.
Because the idea actually here is to try to relieve the pain.
Exactly.
So if he's a bit anxious, you just tell them to come another day until they are able to bear it all.
All right.
Because it's painful, but it only lasts for 3 minutes, the pain.
Yeah.
But the aftermath is very wonderful.
Okay, I see that. All right. So, and which type of bees? Because see, there's the male and the female, right?
Yeah. In the kingdom world, we use female.
Yeah.
They are the most productive.
Okay.
Because the male, they only use their organ only for mating.
Okay.
They don't sting. But for bees, the worker bees, they use it for defense.
All right.
So that's why we use.
Okay. All right. Okay. I'll let you, because I have so many questions, but I'll have a session with you. But let me just.
So, you do sting.
That's it?
The sting is already here.
Oh, okay.
Ready, first sting.
All right.
Then you go the other side. You do the second sting.
Okay.
So you only stings once. So this one,
you
just fly off.
All right. And then that's it.
So technically that's it.
Yeah.
Sometimes we allow the patient to ask for additional points, as long as you know they are.
I mean, he said that ukitaka kunieka ya 5 ni sawa. Okay.
So he's very brave, very courageous.
Yeah.
Very encouraging. But it's because after you realize the benefits, you can be able to bear it.
Yeah.
Because it only lasts for 3 to 5 minutes. Then the pain of the sting is gone. So once at least 3 to 5 minutes, we clearly know the venom is already inside the body. Because what you can see here is the venom sac. So that's the one that has venom inside. And then you've got the barbs that penetrate, or the lancets. So once the venom is already inside the body, then this is no longer useful. So we come here and remove. Then we apply this cream made from beeswax to minimize on the effect of scratching.
All right. Oh yeah, because it can really itchy after. Yes. Yeah. Okay. All right. So you said between 3 to 5 minutes, the venom is already in the system, and then you remove all those things. My question was then, how do you know which dosage to give to a person?
We because is a natural injection. we are not able to really ascertain the content of the composition is still the same, but the volume is a bit different kidogo. So that's why we start with a few bee stings. Progressively we go adding more, especially if you don't have an allergy. So everybody here starts with around four bee stings. If there are no allergy, we add 2, 6. Next time we keep on adding. But the maximum we've had, somebody is taking around 50 bee stings.
In one session. Depending on the condition.
That was severe, severe arthritis.
But then how much is too much? Like at what point then does this become a problem?
Not much, but the pain might be a bit unbearable, which is not the idea. The idea is the liquid venom. So once we do that, some patients feel nice. Keep on adding, and so we say them. Too much of everything is a bit poisonous.
That's true. That's true. All right. So for a case of migraine, right? At what point then do you consider them healed or cured? Because what he said after the first session, he felt better, right? So then, So at what point then do you say,
the patient behavior is a bit different. There are some people, once he was treated by a natural antidote, I enjoy, just do it. So even without having any condition, you also sting ourselves and you don't have a much condition you're trying to treat. So once your condition is healed, no more painkillers, it's not suppression, is actually healing. So they are at liberty. But at least we recommend 3 to 4, then
3 to 4 sessions and liberty. Then you decide whether you want to come or not. Well, Dr. Thank you so much. This is very insightful. I still have so many questions for you, but we're going to have a session with Dr. after the break to really understand apitherapy, what it's all about, what are some of the other conditions that you also treat with the same, because I'm still stuck at the 50 stings per session, but hey, anything to relieve the pain, right? Okay, so let's take that break. We'll see you after the short break to understand more about apitherapy, but for now, thank you so much. All the very best. Utatuambia sasa utasikia aje later on, but sasa umesema unasikia vizuri.
Sasa niko sawa. Nashukuru Mungu tena daktari kwa kunitibu. Kama sio yeye na Mungu singepona.
Hata ungekuwa unaendesha gari. All right, see you after the short break.
Nimejileta.
All right, so see you after this very short break.
Kote nchini mbele tuendelee, mbele Kenya tuendelee,
Kenya twende mbele. NCBA, go for it.
Explore our market-driven programs from PhD, Masters, Bachelor's, Diplomas to Certificate programs. Join our September intake and dive into a world of vibrant student life, ultra-modern facilities, and a globally renowned faculty committed to your success. ZTech University. Invent your future.
Self-reflection, continuous learning, and always putting yourself out of your comfort zone. These are some of the key elements needed in personal growth.
Kutoka masuala ya maadili, uhusiano wa kihisia, hadi masuala ya fedha, mzazi wa kiume ni muhimu sana kwa familia yake.
Personal growth is an individual journey that is influenced by one's beliefs and values.
Wanaume, ukisimama mbele ya wanaume wenzako, unatoa kifua mbele, unajikaza kiasi, si ndio?
Katika dunia inayobadilika kila uchao, ni jukumu lako wewe kama baba mzazi kuilinda familia yako kwa vyovyote vile. Ungana nasi tarehe 3 Agosti mwaka huu hapa Tilisi kwa Gumzo la Mwaka la Man Cave Season 4.
To all car enthusiasts, we got you covered. We are bringing you a fully fledged car clinic. Also join us for amazing sumptuous meals. Not forgetting, grab your tickets at www.kenyabus.com. Tupatane Man Cave.
Want to know the biggest story of the week? Do not worry. The Weekly Review got you covered. For in-depth analysis of politics, business, governance, as well as social issues, the Weekly Review covers it all. For well-researched, exclusive and investigative content, read the Weekly Review every Sunday in the Sunday Nation.
Kenya's sporting heroes will be chasing glory in the city of love. Or is it lights? They are bingwas, superstars who've put the country on the world map. From Wednesday, 24th July, join the sports guru, Elias Makori, who's covering his 8th Summer Games, and Bernard Ndong, who's making his debut in France. Catch the unique show, Bonjour, every weekday from 12:45 p.m. to 1 p.m. on NTV, as the dynamic duo provides you with a Kenyan perspective of the biggest sporting event.
Sisi ndio wale watoto wa Mungu, kitugusa tapigwa na Mungu, na tulipokatuweka Mungu, kimboni ya jicho lake huyu Mungu. Sisi ndio wale twapendwa na Mungu.
To get Sisi ndio wale as your skiza tune, dial *812 *802#.
Skiza na Nation.
My name is Martin Oduor-Otieno. I'm Executive Director at the Leadership Group. Society has become very complex, and there's lots of pressures that men are going through, basically social pressures, issues around mental health, economic and financial pressure. So as men coming together to discuss, to learn from one another, to see what has worked and what hasn't worked, to share stories, success stories and otherwise, and really to use this as a forum for learning, and a forum where men can get support and get better. I would really like to encourage you and welcome you to this forum on the 3rd of August, so that you can share your stories and we can all learn from you. I will be giving the keynote address at this event, and also looking forward to learning from all the participants.
All right, so Stephen, I can see a number of hives. Here, there's one here, there's others here, then there's others there. But I'm really curious to understand the reason behind this. Before we even talk about bee venom, what is it, and all those things, I'm just curious to understand, because you are an engineer, right? Civil engineer, and now you are an apitherapist. How did you get yourself into this space?
Interestingly, being an engineer, I really wanted to have a business that will engage me continually.
All right.
Because engineering, you get a project, once you do, take a while. Then the other cycle of engineering is that once if you're employed, you repeat the same designs over and over again.
True.
So technically, I felt a bit challenged. Like, I'm doing houses. So I started with the dairy. At that time, I was a telephone farmer.
Okay. All right.
So something happened. My 10 cattle died.
Oh, I'm sorry. Yeah.
Then later on, as I was still scratching my head, I saw one of the farming I can be able to do when I'm not around is tree farming. So I thought, oh, okay, trees, by the way, because I just need to be there when planting.
Yeah.
When giving manure, and that's all. So initially I thought about timber. Then I did my summation, 10 years. Then I get my timber, one tree fetches 5 to 10,000. No.
The math did not math.
The math did not. So I said no. What about fruit trees? I'll wait 2 to 3 years. We'll start bearing fruit. I'll be selling. Perfect. I did avocado.
Yeah.
So when they started flowering, I visited my farm and I saw bees pollinating. So the second idea came, bee farming.
Yeah. So then that is how Bella Farm
yes,
grew,
now
right?
that's how Bella Farm was founded. So I went back to school. I first did a diploma, a certificate in beekeeping. Then at least I had the fundamentals. So I bought my first hives. They were colonized. So, okay, fine. It became interesting.
Yeah.
So I said, okay, fine. Now, my tenure in employment, I would say, is 5 years. So I quit 2015.
Oh, wow. Okay.
So I did not look for employment anymore.
Yeah.
So I went for a diploma, a certificate course in Nairobi National Beekeeping, Lenana. I practiced with it for like 3 years. I saw I'm not adding value. So a friend of mine sent me like the apitherapy. Somebody was treating arthritis using bee stings. So, and because I'm a beekeeper, I was interested. So I went and looked for that organization that trains. I found it. So I applied and I paid my school fees. So I left for Romania, go and do apitherapy course. So that's where I found the beehive have got 9 products. And people have only utilized honey, and beeswax.
Beeswax, yeah.
But many people throw away propolis.
True.
They don't know how to harvest royal jelly. They don't know how to harvest beehive air.
Wait, what?
Beehive air. That gas. Those are the third product that people do not utilize.
Yeah.
We have said propolis, royal jelly, beehive air.
Yeah.
We have pollen, bee pollen.
Yeah.
We have got bee bread. We have got the young ones.
Okay.
The male brood.
Yeah.
We call apilanir. Male brood, very nice. Those maggots.
Yeah. You eat them?
Very nice.
Okay.
Very therapeutic.
Okay.
We've got other purposes.
Okay, all right.
Then the last product is the bee venom.
Bee venom, which is actually the subject of our conversation this morning. That is very interesting to understand all these other products that we don't think about, because honestly, majority of the people we just know about honey and maybe beeswax.
Yes,
and
yes,
maybe propolis, maybe. I'm saying maybe very carefully.
Maybe, yeah.
So then bee venom, can we just understand then what is it and, you know, how is this useful?
All right.
Yeah.
The venom is in very small quantities. And studies have been done over and over again.
Right.
But the most active ingredient in the composition of the venom is a component we call melittin.
Melittin, okay.
That's what we target.
All right.
Even the strength of the bee venom is measured using melittin composition, because it ranges from 42 to 51%.
Okay.
So their mode of administration is quite different. We have got 3 or 4 modes of administration. We've got the bee sting therapy itself. The one I'll do to you.
Okay. All right.
Advanced economies are extracting and producing injectables. We've got body creams using bee venom.
All right.
And then, so topical application, injectable,
all right,
and the bee sting. The direct bee sting therapy.
Okay.
Yes.
You know, for all those things, let's just sit so that we really understand, because I'm curious to understand. So what part of the venom is it considered then, I would say, medicinal?
Ancient history, beekeepers were observed, they don't get certain kind of conditions. Why is it? Because everybody eats honey, not only the beekeepers. The other bee products to those advanced economies, they were also being consumed. So the only thing that the beekeepers were experiencing were the stings. And if you read through the history, there are some things that happen accidentally. You find somebody had like a condition, they were stung by bees, like Lyme condition. They were stung by bees accidentally, then the condition was improved or healed instantly. So they were observed beekeepers don't get arthritis, they don't get tumors and cancers. So that thing which was isolated that beekeepers only experienced and not the other people was the venom. So when studies were conducted by medical doctors, Bodox in Austria, and some German researchers, it was isolated that the venom had some medicinal component. And that's why beekeepers were immune. And actually, the other factor is that beekeepers live longer. There's longevity. And studies began as early as 1800. So that's now, it has come of age. Now they're even able to do the injectable.
But can we understand that some of these conditions that the bee venom treats? We've talked about arthritis.
Talk about arthritis. We've talked about migraines.
Which, yes.
We talk about numbness, malaria.
You can use malaria.
Yeah, for bee stings, yes.
Okay.
There's fatigue.
Oh yes.
You know,
and there's some people who suffer from like chronic fatigue.
Chronic fatigue, yes. We've got some like some skin conditions.
All right.
We've treated wounds by once we clean and we see like started reddening.
So I'm curious to understand. So the venom helps to deal with the inflammation. What happens that this person is considered healed, or what exactly happens?
There are 3 forms of reactions.
All right.
There is normal reaction that if you're stung here, just it will heal here. There's a general reaction. You're stung here, then the whole hand inflames.
Yeah.
Those are still safe.
Yeah.
But the worst is you're stung here, then you start scratching the whole body. It can cause anaphylaxis.
All right.
So that's a bit risky. So that's why we actually first do an allergy test for any patient who comes along, because we must be very certain about if they are reactive. Within 3 days, the inflammation will come down. If you inflame, you heal faster.
All right.
So we actually take through a patient through the process to understand what is it all about, what is the expected outcome. Then our patient will tell them there are 3 probable outcomes in terms of healing. There's somebody who really heals very well. There's somebody who improves their condition. Then there's the last group that resists.
Okay.
But the beauty about even the group that resists is that the condition is contained, so it doesn't worsen.
So then how do you know where to administer the sting?
There are traditional Chinese medicine, they use acupuncture points.
Right. Yeah.
And those acupuncture points, like...
oh, you have a model here.
Yes.
Yeah.
So we have these meridians. These are called meridians. And all these meridians, all the way from here, from the foot, coming all the way the toes, all the way to the... Those are external. Then we have got the internal organs, like the brain, the heart, the intestines.
Kidneys as well. Yeah.
So you cannot sting them.
Yeah.
So there are these points that are related to the internal organs.
Yeah.
So for the brain, there are these there are 13 meridians. So there's gallbladder, there's bladder meridian, there's the heart meridian, there's pericardium meridian, small intestine meridian, kidney. So there are 13 of them.
Right.
But for each point, there's a cardinal point. Then that point, if you touch and you sting, you get better results.
Okay.
So for then, those are for general points. Then we've got the local points. If you've got a condition like arthritis, there's the local point. Maybe on the knee, on the heel, on the arm, elbow, on the shoulder. Those are local points. So those are administered directly.
All right.
But the general points, you must know which point leads to the internal.
Okay, I see that.
Yes.
And the dosage as well. How do you know what dosage to administer? Because I want to believe like it's not the same. And you also talked about it being progressive.
Yes,
so one might start with a certain number of stings and then either increase or decrease.
All right.
I want to believe.
An increment.
Or an increment mostly.
An increment.
Okay.
Then there's a point where the patient will feel that was a bit too much. Then you stabilize with them. So this is what happens. You must learn from somebody. So I was taught by a medical doctor who's an apitherapist in Romania. So for you to be able to determine the dosage, every patient is unique in their own way.
All right.
And remember, this the venom is not graduated because every bee has its own concentration based on age and what is on in the environment in terms of pollen.
All right.
So that one is not graduated. So what we do is that we start, at least for the first time, we don't exceed 4 or 5.
Okay.
After doing the allergy test.
Yeah.
So once you're verified, like 4 worked for them, next time you add 2, they become 6. Next time you add 2, they become 8. Next time you do 10, then they will tell you, no, last time it was a bit severe. So you'll know that patient, they just require 8.
Yeah.
That's the,
and then that's it.
Yeah.
Yes.
But we've had a case where a lady, even we did 54.
So then, depending on the condition, at what point do you consider this person healed or cured?
We actually recommend for migraines and for numbness, because we know they are more of instant kind of treatment. We recommend at least 3. But for the stubborn ones, we don't limit.
All right.
Simply because it is the patient that will feel like, wow, my condition is contained.
Yeah.
So let me break for a month and see if it's truly contained. Then maybe I'll continue. We recommend somebody, even if you are treated, because you're not immune, just make it like, now you know, just once in a month.
All right.
Whether you're healed, whether you have a condition or not, we also do it on ourselves because it's also an immunostimulator.
You know, I was about to ask, do you have to be sick for you to?
Nah, it's an immunostimulator.
Apitherapy, so you don't have
that.
Oh, do you wanna?
No, don't worry.
You sting yourself?
Yeah, I'll do.
Okay. But then, so do we have, like, as you do that, do we have instances where, like, the venom is too much in the body that a person maybe reacts to the same? Ow! So you said what? Okay, fine.
And then within 3 minutes, 2 to 3 minutes, the pain is over.
I'm actually getting goosebumps. Okay, fine. Fine. Let's try. Yeah.
Let's try.
Yeah.
Then, no more pain, no more itchiness.
It's gone.
Yeah. It's all
and
removed.
Yeah.
It's all removed.
Oh wow. Okay, so you don't have to be sick, but yes, but the questions I asked, even as you do the, okay. Well, we're doing first what the allergy test. An allergy test is just use the bee sting.
Yeah, but the concentration we just let it like just 5%.
Okay. You sort of like need to count me down, okay?
Happy thoughts.
That's it? That's it? No, you haven't done any. Have you?
This one. This is the sting.
Oh wow. Okay, yeah. I mean, I now. Oh, okay, yeah. It's itchy. Look at my face. I have goosebumps. Oh. Okay, that wasn't too bad. But that was what, for the test?
Yeah,
that's for the
sting and remove.
How? Yeah. I spoke too soon.
So you can feel it?
Yes.
Then wait for like count 20 seconds.
You did hear, right?
Yeah, we'll see it.
Okay, so as we wait for that, ooh, I feel like itchy. Okay, so do you have like instances where people have like too much venom that they sort of like react to the same?
No, actually.
Ooh, wow, yeah, that hurts.
Yeah.
Ooh.
We didn't have actually an emergency.
Yeah.
Somebody was brought from outside.
Okay.
From the village. He has been stung by bees when he was doing his chores at the farm.
Yeah.
So he was a bit unconscious. So we just handled it and within 3-5 minutes he was okay.
Okay, but then in case someone comes and then you do the test, the person develops an allergy, then what do you do?
No, in that case we've got antihistamine. We give them. So in case, but we just have to
majority of the times,
yes.
And what about like the cosmetic aspect of the same? Because you said that happens as well. So you do
If you do the venom cream, it is anti-wrinkles. It's anti-wrinkles.
Okay.
Because it activates collagen.
All right.
So your skin again that is of course if you're not much, you don't have much wrinkles. But if you're already developed, then the regeneration aspect might be not as effective, like somebody approaching that facial wrinkle.
So do you do like the stings on the face, or that has to
No,
be
we do the venom, then we do the cream.
Oh, do a cream from the same.
So then you apply.
Are people embracing that?
We don't have even volume to do that.
Oh.
Because one casting like this would be hundreds of,
I can imagine.
very expensive.
Yeah.
But once we get the venom, we'll definitely do it.
Yeah.
Because of course, nothing is expensive to somebody who's wanting to achieve something. And if it works, why not?
Okay. But as we bring this then to a close, in terms of people, first of all, understanding and embracing apitherapy, where would you say we are at as a country? And what are some of the key important factors that people really need to understand? Because again, there will be, people who are skeptical about it, as far as, does it really work? Does it heal? And all those things. And also practice safely. Because when we say just get yourself, stung, but some people might actually abuse that, right?
Yeah.
Just go somewhere, get a bee, sting themselves, and then that's it. So what would you say as we bring this to a close?
Even if you get a bee sting in the field, it will still work the same way. But at that point, if you don't know your allergy reaction, it might put you at a risk.
Okay.
But if you follow the right apitherapy, like here in Bella Farm, we very certain like it is not harmful to you, because actually already the patient is in pain. So we don't want to add
More pain
that will not relieve the pain that they are having. So in terms of people are doing it, it's a bit risky, and that's why it's a bit procedural. So that like any other medical, the conventional medicine, the alternative, the herbal medicines, you cannot overdo anything. No matter how good it is, even honey, no matter how sweet it is, you cannot exit some intake. So in terms of people understanding how it works, we have a duty to educate
people. That's
we
true.
have a real duty.
Yeah.
And one of the things we are doing is that we are having some organizations, not real organization, but we are visiting some of our farmers, organizing them into groups, and then educating them on the other bee products, because most of them are after honey.
That's true.
And then, the moment they have low harvest, they abandon. But if somebody knows, like, even that bee sting I get from there is healthy for me, it is no longer mythical, like bees kill. You will find some people starting embracing warmly until we have got quite massive numbers in terms of even provision of
now I understand why, like you said earlier on, that sometimes when people come to you, they want more. Like after the first thing, they're like, can I have more? I mean, anyway, Mr. Minor said, ata kitaka kujiongeza ya tano, that's it. So can I have like one more? Because it's not too bad. Initially, I was scared because it was like, okay. So can I have like just
maybe we
one
can do the other hand.
Okay. All right.
Just relax. I mean,
okay.
If you just relax.
Okay. It's not now I
you've
know.
done the whole cycle.
It's not too bad. Okay. All right. So as we bring this to a close, just one. I don't want to look, because I think if I look, I'll be more.
Just look. Just look at it.
Oh, okay.
Just look at it.
All right.
It's a way of grieving your.
Yeah. Okay. Ah, wow. Oh, wow. Oh, wow. Okay, yeah, that I felt. Ooh. My therapist.
No, just leave it.
Ow. Can you see all the goosebumps on my face?
It's because you're scared. Nothing to do with the reaction.
Wow, okay. All right, yeah. But I mean, yeah, it's just like for a second.
Just that observation, you're just scared at the sight.
Yeah.
Nothing.
And then that's it. Yeah. And then the pain literally subsides. Listen, guys, it's not too bad. It really isn't too bad. And if you suffer from like those chronic, illnesses, and you're in chronic pain and all those things, listen, you might actually consider trying apitherapy. It's not too bad. You just feel the sting, and then, give it a few minutes, and then, the pain subsides. So are you a believer?
right now? See what I did there? Okay, well, fine. If not, that's it for this month's segment as far as understanding apitherapy and what it's all about. So we'll see you after the segment. Well, after such an in-depth discussion as far as understanding apitherapy and the benefits versus the risks, now you have a better understanding. So if you want to try, then you know where to go. But for now, I'm going to bid you goodbye and go get myself more products, including honey, maybe beeswax. Maybe I might get more shot from the same as far as apitherapy is concerned. Well, we'll see. But for now, goodbye. See you next time. And all the very best. It might be weird to think that something that causes pain and swelling might actually be used to treat things like pain and swelling. Ama paka hapa, unataka so nishukie tu hapa.